A lot of patients will come in and say, I don't want a deep cleaning or any of that scaling and root planing. That's very difficult for us when you put us in that particular situation, because that is treatment that you need and we can't overlook that. A lot of times it's money. That's a very logical reason, but unfortunately, as a licensed dentist, one who has been put out to take care of people's dental health, we can't overlook that. You come to us to take care of your mouth and to provide the best care possible. And sometimes that requires treatment of periodontal disease. So when we do that, we do one round of the scaling and root planing, but then we want to see you every 90 days. And my explanation to patients as to why every 90 days to have what we call periodontal maintenance, which is a specialized cleaning for gum disease patients, is that the bacteria that cause gum disease colonize after about 90 days. And I live actually right up here near a big military base. And I always think of one soldier being something that you don't want to mess with, but if you have 90,000 of them right next to each other, that's terrible. They can do great damage. Unfortunately, periodontal disease is not unlike diabetes, heart disease, some of the more chronic diseases that we have in our lives that we have to take care of. So we want to make sure that we're on top of that. Just like your diabetes, you can't go to the doctor once and have it fixed. You have to maintain treatment. Periodontal disease is the same way. We want to make sure that every 90 days we get in and disrupt that colonization, that multiplication of the bacteria, so that we can break it down to a more manageable level. Sometimes we have antibiotics that we can squirt down into the pockets. Sometimes we take oral antibiotics, but there are a lot of different ways that we take care of that.